I'm Dr. Warren Levin, and I am currently practicing in Vienna, Virginia. I am board certified in several specialties, but I am doing much more of my work now in Lyme disease. I was living in Connecticut, and I was practicing in New York City, and I got tired of the 2-hour commute. So I opened my office one day in Connecticut, and I suddenly ran into this locomotive. There were no ticks between the cracks in the sidewalk in New York. And I think many New York physicians didn't understand that there is Lyme disease. I know I must have missed many cases until I found out what was going on. Most of the patients that come to see me, I've seen 5, 6, 10 doctors, and when you start with that kind of a base, anybody that gets well is a distinct gratification.
Yes, very, very happy, lots of happiness.
So I find it challenging, and I find it rewarding, and I find it frustrating at times.
We heard you're also a Lyme, and we would like to know, when were you diagnosed and how has this experience been for you?
It was in the early 90s, and I was in pretty good shape, and I was exercising regularly, and I got on my Nordic track one day, and I couldn't do my routine. I just was so tired. And I had
something unusual.
Yes, and I had just recently heard the first thing about Lyme. A local hospital gave a one-day seminar. The CDC came to teach about it. And I said, boy, I must have Lyme. I didn't see a tick. And I treated myself.
But you thought you had Lyme just because of a fatigue or because
Yes,
it was extreme?
It was really profound fatigue. I never had anything like it. And I took 4 weeks of doxycycline. And I was fine. Almost a year to the day later, I had the exact same experience on the Nordic track. And I said, what's going on here?
You relapsed.
Well, at first, I thought I might have had another bite. I was living in an area of Connecticut that was definitely suburban, and we had a lot of deer all the time. My introduction was a CDC presentation that said there's no such thing as chronic Lyme disease. I did not do the tests that I now do to follow the activity, the CD57 and the C4A. I did get tested for the basic co-infections.
You did?
Yeah.
And you had them?
Nope.
Lucky you.
Amen. And before I finished the course of antibiotics, I had an infection in the PICC line. And I don't put the PICC line in, and I don't do it. We have a home care agency that's professionals that do it. And I have had way too many infections. I now use intramuscular bicillin every 3 days.
Every 3 days.
And I find it very successful. I think when I run into a patient with a severe neurological syndrome,
Yes.
I will consider using an IV
For how long? For how long?
Well, I said a month or so, but really it depends on the response.
On the patient. Doctor, and would you say the guidelines of CDC are not proper to take care of Lyme disease, are not enough?
I really believe that most of the infectious disease specialists are doing what they believe is right because that's what they've been taught. I don't think they're living on the same planet that I'm living on. And I think it's one of the tragedies that people go through the 2-tier tests and are told they don't have Lyme, and it isn't in any way capable of assuring. So I just think the whole system of teaching and research is not functional. When people have Lyme, their immune system is impaired, not to the degree that an AIDS patient is, just blown out, but they end up coming down with multiple viruses, cytomegalovirus, Epstein-Barr virus, HHV viruses, and they are...
That makes it harder to treat.
Well, they make it complicated. For many people who had it for a long time before treatment or inadequate treatment, the prognosis for recovery is in months to years.
So what would you say to a patient to do in case the patient is not having a medical health, or, what will be your recommendations to a patient if you can give us some directly to them, like in food, in their diet, exercising, in treatment?
Well, because my background was in family practice and then became alternative. I don't like alternative medicine. It means they're here and I'm here. So it was holistic medicine, and complementary medicine means that we're filling in gaps in the mainstream approach, and I think that is
the perfect medicine.
A very good name. And then integrative medicine describes that integration, and functional medicine means that we are looking at the function of why people get sick, why the body's built-in system for repair doesn't work. We have to find out what's interfering with the self-repair mechanism that we all are born with. So
for the patient,
it's not trying to put a name on the diagnosis, it's trying to find as many different things that are interfering with recovery and support them. So an infection is certainly one. Nutritional deficiencies are very common. Toxins are very common. Allergies are very common. Hormonal deficiencies.
yes.
Neurotransmitter problem.
And you treat for all that.
Those are the list of things that I'm looking for. And the alternative is to look for 60,000 different diagnoses with a code. So my list is very short.
Well, doctor, I am very happy that you have recovered so much. And I think the most important thing that you said is that you are happy taking this challenge, because it's a very big challenge. And not many doctors are willing to do it, and to do it with the heart, and you have demonstrated. So we wish you the best of luck, and with your book and everything.
Yes, I have to tell you, my book is a prime example, because the state of New York was going to make me the prime example of what they were going to do to other alternative doctors. I feel privileged, truly, to be able to do this work. And and help spread the word.
Thank you.